In rounds this morning, we talked about 2 spinal injuries. One was in a 14-year-old from years ago that broke her neck. It was a fracture, dislocation, or really just a dislocation at one of the jump gyms. Another guy that had an autofusion of his spine and fell off a ladder and broke it. When we are preparing to treat somebody that's come in with a fracture, obviously you can't prepare. It's not like an elective case where we know they're going to have surgery next Thursday and we can get all the sets there. What do you do, Scott, to make sure that we're ready to be able to treat the acute spinal conditions that come into the emergency room?
Great case discussions this morning. And I remember that first girl, the 14-year-old that came in vividly.
Yeah.
And
it was 10 years ago.
10 years ago.
Yeah.
Wow. It doesn't seem like it was 10 years ago, but I remember when she was brought into the operating room and looking at her images, and she had the bilateral jump facets, and I thought, oh my gosh, how are you going to reduce that?
Yeah.
And I remember she was in position with the Mayfield on, and you pulled extreme traction, and I thought, oh my gosh, you're gonna injure this girl furthermore.
Oh, thanks for not telling me that.
And of course I trust you, and you heard this.
You trust me now.
Pop, and you're like, oh wow, well we just reduced her. We got some more images, and sure enough, she was reduced. And now it was time to stabilize her because she's got the ligament issues, and that's where I come into play to provide you with hardware. And so you did traditional ACDF and put an interbody cage in and plate fixation. But we always have those trauma sets available for patients that come in that need fixation.
Yeah, that's been a blessing. To the instrumentation, with rare exception, is just available.
Sure.
And you are also just available. That's another thing, is
always available on trauma call. It's part of what we do, and it's fun. It's fun to be prepared, and you don't know what's going to come in, but you want to be prepared for everything.
So we've worked together for 10 years. It's got to be thousands of cases that we've done.
Wow.
I was talking to my mom last night, trying to explain like how much we actually work together.
Right.
For 10 years, probably more days than not, because we operate more days than we don't. You have been in the operating room with our team for the majority of the day, I would say.
For sure. Yeah, absolutely.
It's crazy how many times, how many people do
thousands of cases
know or work with. If you were to look back on the last 10 years, what are some of the most memorable trauma spinal injuries for you?
Oh boy, there's been a lot of them, and you can go back and think, but going back 10 years, the one that sticks out the most is our friend Louie, who had the ski accident, who was brought off the mountain and had multiple fracture dislocations, but he by far sticks out in my mind more than any other fracture, just because of his story. And we've stayed in touch with him over the years, and we've even skied with him after his injury, so that one really sticks out.
He was paralyzed from the injury, but his spirit and his gratitude were almost increased, I cannot get over how resilient he was through that.
We've seen a lot of trauma over the years, a lot of fractures. Some come with some sad stories, and some are stories that end with a good result, and you can fixate them and they're back to a normal quality of life. Another one that sticks out is a gentleman that was just riding his road bike, and he happened to have a tree fall on him. If you remember that one. And I believe he didn't have a favorable outcome. I believe he was paralyzed.
Well, yes, he had a horrific accident. He required lots and lots of care. I think he was in the hospital for several months. We treated him later in his course because he had developed some persistent issues related to the underlying trauma, and to sort of understand the whole history there was really quite something. And he was a gracious and humble and wonderful man, and his wife was really quite remarkable. She was so supportive. But the sequelae of his injury was significant, and they just moved forward and continued
Right.
on. I was asked recently why I still take call at the hospital. I'm busy enough just doing elective surgery that I could easily just say, well, I don't need to take call at the hospital. However, I think that it's a wonderful thing to be available in it, not every single day, because that would burn somebody out,
Right.
but in a rotation, to be available for patients when a crisis happens. And
Right.
some of my favorite, most memorable patient stories have happened in the setting of trauma and the acute emergency room care.
Sure.
So,
Well, you grew up in this community, and it's nice to take trauma call and take care of the community that you grew up in.
Yeah. So it's really been a privilege to make ourselves available, I think. And then it was kind of fun this morning in rounds to reflect on 2 spinal injuries that both happened about 10 years ago, and they're still very vivid in my memory. And thank you for always having the trays ready and personally being available basically in a moment's notice whenever we've needed you for more than 10 years now.
Absolutely. Well, don't stop taking trauma call, because I actually really enjoy it. I love the excitement.
Yeah,
of
we
it.
don't have any plans
It's
for that yet.
unpredictable,
Yeah.
and you just have to be ready and have your trays ready for any trauma that may come in. But I thoroughly enjoy it.
Yeah, I do too. Thanks, Scott.
Yeah. Thanks, John.